Do you often find yourself worrying about things that are out of your control, particularly when it comes to your health or medical procedures? This video is here to alleviate those concerns, specifically those tied to anesthesia. It's completely normal to have fears, but it's also crucial to understand why these common anxieties are usually unnecessary. Knowledge is power, and with the right information, you can enter your next procedure with less stress. Let's dive into the top 10 things that you should stop stressing over anesthesia. First on the list is the fear of not waking up. This is a common concern that many people have when it comes to undergoing surgery. But let me assure you, it's a fear that is largely unfounded. Anesthesia, in the hands of skilled and highly trained professionals, is extremely safe. Anesthesiologists undergo years of rigorous training and education to ensure they can safely administer anesthesia and monitor your vital signs during the procedure. They are there to keep you safe and comfortable. Moreover, the advancements in medical technology and practices over the years have made the process even safer. Statistics show that the chances of not waking up from anesthesia are extremely low, almost negligible. So, while it's normal to feel a bit anxious before a surgical procedure, it's important to remember that the fear of not waking up is largely unnecessary. So, trust in the professionals, and know that they have your best interests at heart. Secondly, many worry about feeling pain during surgery. Let's break it down. Anesthesia is a medical marvel that blocks the sensation of pain. It's like a protective shield that prevents your brain from receiving any distress signals from your body during surgery. There are two main types: general anesthesia, which puts you into a deep sleep, and local or regional anesthesia, which numbs a specific area of your body while you stay awake. Anesthesiologists, the specialists who administer anesthesia, are your guardian angels in the operating room. They closely monitor your vital signs such as your heart rate and blood pressure throughout the entire procedure. If they notice any changes, they're ready to take swift action. Their primary goal is to keep you comfortable and free from pain. They're experts in their field, having spent years perfecting their craft. So, when you're lying on that operating table, remember, you're in good hands. Rest assured they'll ensure you're comfortable throughout the procedure. Third, the fear of side effects often causes stress. It's a common concern, but let's put it into perspective. Side effects from anesthesia, while possible, are usually mild and temporary. They can include things like a sore throat, minor muscle aches, nausea, and fatigue. Sounds unpleasant, right? But here's the thing. These are typically short-lived and manageable. Anesthesia has come a long way, and the medications used today are safer and more efficient than ever before. The chances of experiencing severe side effects are incredibly low, and you're not alone in this. Anesthesiologists are trained professionals who are there to ensure your comfort and safety. They monitor your vital signs closely during the procedure, and work to minimize any discomfort you may experience. So instead of losing sleep over potential side effects, take comfort in the knowledge that you're in capable hands. Remember, your anesthesiologist will discuss potential side effects with you beforehand. This way you'll be prepared and informed, which is the best way to alleviate fear and stress. Fourth, some people stress over potential allergic reactions. Now, it's important to note that allergic reactions to anesthesia are extremely rare. In fact, they happen in less than 1 in every 10,000 cases. This is much less common than allergies to everyday substances like pollen or peanuts. Even in the unlikely event that an allergic reaction does occur, anesthesiologists are equipped with the knowledge and tools to manage it swiftly. Before your surgery, you'll have a detailed conversation with your anesthesiologist about your medical history, including any known allergies. This helps them select the safest anesthesia option for you. Furthermore, the operating room is always stocked with medications to treat allergic reactions, and the team is trained to respond quickly and effectively. So while it's normal to feel anxious, remember, you're in safe and capable hands. Your safety is their top priority. Fifth, the fear of saying something embarrassing while under anesthesia. Now this is a concern that pops up quite often, but let's quell this worry right now. Embarrassing confessions under anesthesia? It's a scene straight out of a sitcom, isn't it? Contrary to popular belief, it's highly unlikely that you'll spill your deepest secrets while you're under. Anesthesia, especially the general kind, works by inducing a state of deep sleep. It's not a truth serum that will compel you to share your most embarrassing moments. Anesthesiologists are medical professionals who are focused on your physical well-being during the procedure, not your verbal slips. Even in the rare case that you do utter something, rest assured, they've seen and heard it all. Your words won't faze them. So let's put this fear to bed. You're there for a medical procedure, not a truth or dare game. Don't let this fear add unnecessary stress. Remember, your health and safety are the primary concerns here, not potential embarrassment. Sixth, some fear that the anesthesia won't work. This fear is understandable, yet it's crucial to remember that anesthesiologists are highly trained medical professionals. Their job isn't simply to administer anesthesia, but to monitor your body's reactions throughout the entire procedure. They keep a keen eye on your vital signs like heart rate, blood pressure, and oxygen levels, adjusting the anesthesia dosage as necessary to ensure you stay comfortably unconscious. The monitoring equipment they use is extremely precise, providing real-time data that allows them to make immediate adjustments. In fact, anesthesiologists spend years learning how to expertly manage these medications and monitor their effects. They're skilled at ensuring the anesthesia is working properly, and that you're both comfortable and safe during your surgery. So while it's normal to worry about anesthesia not working, remember that it's in the capable hands of trained professionals. They'll ensure the anesthesia is working as it should. Seventh, the fear of long-term effects from anesthesia. This concern is one that resonates with many. However, it's important to understand that modern anesthesia is designed with safety in mind. Anesthesiologists and nurse anesthetists are highly trained professionals who administer anesthesia in a calculated, controlled manner to minimize any potential long-term effects. Your anesthetic plan is tailored to your individual needs and circumstances, taking into account factors such as your age, weight, medical history, and the type of surgery you're undergoing. This personalized approach helps ensure that you receive just the right amount of anesthesia, reducing the risk of long-term complications. Furthermore, you're closely monitored throughout the surgical process. Your heart rate, blood pressure, oxygen levels, and other vital signs are tracked in real time. This constant vigilance allows for immediate action if any issues arise, further safeguarding your health and well-being. So, while the fear of long-term effects is understandable, remember that the process is in the hands of skilled professionals. Trust in the process and the professionals. Eighth, the fear of an anesthesia overdose. Now this is another common concern that can cause a lot of anxiety. But here's the thing, anesthesiologists are highly trained medical professionals. They have spent years mastering their field, and that includes learning how to calculate and administer the correct dosage of anesthesia. It's not a one-size-fits-all situation. The dosage is tailored to your specific needs, taking into account your weight, age, medical history, and the type and duration of the surgery you're undergoing. This personalized approach ensures that you receive just the right amount of anesthesia, not too little, and certainly not too much. Furthermore, during the operation, your anesthesiologist constantly monitors your vital signs, adjusting the anesthesia as necessary. They're there to keep you safe and comfortable throughout the procedure. So while the fear of an overdose is understandable, it's important to remember that you're in good hands. Your anesthesiologist will ensure you're receiving the proper amount of anesthesia. Ninth, the fear of being conscious during the procedure. This fear can be quite disconcerting, yet it's important to know that anesthesiologists are experts in their field, equipped with advanced monitoring technologies to ensure your unconscious state during surgery. They monitor your vital signs, such as heart rate and blood pressure, and even brain activity, to ensure that you're properly anesthetized throughout the surgery. These monitors help them adjust the level of anesthesia as needed, ensuring you remain comfortably unconscious. In addition, anesthesiologists and their team are present throughout the entire procedure, vigilantly watching over you, ready to respond if there's any indication that you're regaining consciousness. It's also worth noting that the phenomenon of being conscious during surgery, known as anesthesia awareness, is extremely rare. Studies suggest it occurs in only about 1 to 2 out of every 10,000 cases. In conclusion, the fear of being conscious during surgery, while understandable, is largely unfounded. This is an extremely rare occurrence, so there's no need to stress. Finally, the fear of post-operative nausea. This is a common concern among patients, and rightfully so, as nausea can be an uncomfortable post-surgery experience. However, it's important to understand that anesthesiologists are well prepared to manage this side effect. They have a variety of anti-nausea medications at their disposal, designed specifically to combat post-operative nausea and vomiting. These medications are often administered during the surgery itself, as a preventative measure, so even before you wake up from the anesthesia, the fight against nausea has already begun. Moreover, anesthesiologists will tailor your treatment plan based on your specific needs and risk factors. For instance, if you have a history of post-operative nausea, They'll take this into account and adjust your medication accordingly. The goal is to make your post-surgery recovery as smooth and comfortable as possible. So, while post-operative nausea is a valid concern, remember that there are effective ways to manage this, so don't let it cause you unnecessary stress. To wrap things up, it's normal to have concerns about anesthesia. We've walked through 10 common fears, from the worry of not waking up, to the fear of post-operative nausea. However, it's vital to remember that these fears are often unfounded. Anesthesiologists are highly trained professionals, equipped to handle any situation that may arise. Their vast experience and knowledge ensure your safety and comfort. Remember, knowledge is power. So take these points to heart, and don't let unnecessary stress get the best of you.